We'll start with the Smokefree Coalition. Effective advocacy, the tobacco story. So please welcome to tell the story, Executive Director of the Smokefree Coalition, Dr Prudence Stone.
Tēnā koutou, tēnā koutou, tēnā koutou katoa. What an honour to be here, and I'm quite daunted actually, being the first up. The Smokefree Coalition was established in 1995 to support an increase in tobacco control interventions and activity by both government and non-government agencies. Oh yes, thank you. So that's important. Next year it will be 20 years old. And that gives me great pleasure in saying I'm 41, so it's nice to say that I'll be 20 next year in my work life. And I came on board only in 2009, so relatively speaking, I'm a sprint chicken to this kaupapa. These days, other national networks often approach me asking for the lessons that they can learn from tobacco control activity. And the conversation always starts with something very flattering, like, since you've come on board, Prudence, tobacco control has gone in leaps and bounds. Tell us what the difference you've made. And I think that's quite a short-sighted sort of point of view. I'll certainly devote a lot of this presentation to the pressure points I've applied to the sector's body of work. But short-sightedness is certainly not a lesson you should learn from tobacco control's story in New Zealand. Much the opposite. In the early days of the coalition's existence, a lot of hard yards were put in that made my work these days very smooth sailing. Some of you may know that the Smokefree Environments Act was legislated in 1990. But it didn't really cut its teeth as a staunch piece of legislation without the initial work of the members of the Smokefree Coalition to ensure that workplaces became smoke-free, the hospitality environments, restaurants and bars became smoke-free, and then of course it was very important for the members of the Smokefree Coalition to advocate that New Zealand become a signatory to the World Health Organisation's Framework Convention on Tobacco Control. So that was the first 10 years of hard yards put in by the Smokefree Coalition. So by 2005, we had accomplished some serious amendments, and we had 21 key health organisation members. No? There we go. Always active whenever my office put out the call to action. And then tobacco control researchers in New Zealand dared to dream something truly visionary for New Zealand's future, an end game for tobacco. So with the Smokefree Coalition's help, a steering group of the nation's key strategic thinkers was put together to develop the rationale and strategy for achieving a tupeka kore Aotearoa, or tobacco-free New Zealand, by 2020. The Smokefree Coalition's idea of collaboration expanded at this point. It stepped up from simple public relations exercises with free media and supporting correspondence and direct advocacy between its members and New Zealand leaders, to network think tanks and ongoing nationwide consultation with the sector, to collaborate on this radical vision. We moved from a discourse to determine what one intervention was next amongst our vast list of urgent next steps, to understanding them all together and the lasting legacy this amalgamated landscape of tobacco control would leave for our future generations of New Zealanders. The Smokefree Coalition, of course, had a partner, a treaty partner, a Maori coalition, Te Reo Marama, a Maori coalition for tobacco control. Nothing the Smokefree Coalition did was without the active partnership and leadership provided by this partner. While the Smokefree Coalition's key message in its public relations exercises were those of the cost to health caused by tobacco, Maori tobacco control leaders focused and had key messages of far greater significance, because tobacco use was not Maori tradition. Maori had been tupeka kore before Pakeha showed up. So cessation and prevention of tobacco use for Maori was an issue of Maori sovereignty. And we had strong leaders inside our coalition government, finally, Maori sovereignty leaders. I'm talking about Mr. Hone Harawira, who, that's him in the back steering that waka there, who were keen to find a unique platform for marrying the health promotion messages of the Smokefree Coalition with the sovereignty issue for Maori communities. Mark Peck, my predecessor, the former executive director of the Smokefree Coalition, suggested that the Maori Affairs Select Committee could provide that platform. So this is a pretty picture I drew, I hope you like it, of the Maori Affairs Select Committee driving their waka towards a smoke-free Aotearoa. So in 2009, this Select Committee announced it would hold an inquiry into the tobacco industry in New Zealand and the consequences of tobacco use for Maori. Isn't that an amazing inquiry title? And after years of think tank development, the Smokefree Coalition was ready. It was finalising its vision for 2020 documents. And I was hired as the executive director, so as you can see, for me it was like my kaupapa had truly just landed in my lap. My job was simple: publish those documents, disseminate them as widely as possible, asking everyone on my database to buy into its key messages, and then be the mouthpiece for delivering them to the Select Committee. This part was simple because since 2007, the Smokefree Coalition had been supporting widespread consultation and a think tank, preparing the sector and its stakeholders for these key messages. Now, we've got killers for enemies in tobacco control, and we can't ever forget it. I think for us in health promotion, the more clear we are about who our real enemies are, the more effective we will be. And they are not people who smoke. They are the multinational, multi-billion-dollar companies who make a profit from our people's addiction and disease. We knew that when this inquiry came to the crunch, the tobacco industry still considered itself protected by arguments that rested on the premise that they made legal products that they marketed to consenting adults. Mr. Harawira was passionate and outspoken on this. He wanted to lynch these bastards. He saw and heard from his constituents, and heavy smokers they are in the north, or they were in the north. The prevalence is, he can proudly say, it's going down. But he listened to his constituents, and they told him that a simple solution was to ban smoking. But we knew, after years of think tank development of the vision's rationale, the sector was anxious not to turn tobacco into another illicit product that Maori did anyway. Banning it could easily turn tobacco into one more means for putting more Maori on the other side of the law. And remember, 1 in 2 adult Maori women smoked in 2009. We didn't want to turn 1 in 2 Maori mums into criminals overnight. Now, Mr. Harawira is an incredibly sharp and intelligent man who also saw how useful he could be, continuing to call for the simple solution, a brutal solution that would be at the expense of some of his own people, so that the Smokefree Coalition's representatives would appear less radical, more conservative with their approach of a vision for 2020. Let's face it, we are so much smarter than our media reporters. We can harness that advantage so that the public realm is spun a story within a flattering backdrop. And that's what we did through effective partnership between Maori and non-Maori coalition forces. We framed the debate, and with our framed debate, we maintained media spotlight upon our marriage of cessation promotion messages and health inequalities for Maori for over a year as our sector submitted to the Select Committee. We effectively kept the tobacco industry's arguments over in its own corner. We transformed the image of the tobacco industry from a law-abiding business citizen into a Maori killer. And in its inquiry report, Maori Affairs recommended government set a date for when Aotearoa would become smoke-free. It also made 40 more recommendations for the sort of measures a government should take toward becoming smoke-free without banning smoking. A smoke-free nation is one where the demand for tobacco products is so low and the regulation environment for manufacturing, marketing and selling tobacco is so complex that the tobacco industry would find it too difficult, too inconvenient to invest in New Zealand's marketplace any longer. In a nutshell, we're talking about a return to Maori tradition and sovereignty from these imperialists. So, in March 2011, government responded to the report with a commitment to making Aotearoa smoke-free by 2025. It's not 2020, I can live with 5 years extra. A huge chapter of the Smokefree Coalition in developing a vision and winning its buy-in from a sector and then a government had been closed. The vision was now a goal and a mandate. Then it sinks in. That was the easy part. The real work is honing all that incredible network capability again and again and continually now for the purpose of increasing effective cessation and preventing uptake amongst young New Zealanders. It would be really nice if policy turned magically into reality on the ground, but a commitment to do something is at least an acknowledgement that tobacco control needs advocacy, needs a Smokefree Coalition, now more than ever. Our purpose has shifted from winning buy-in for a vision to now turning it into reality via strategic planning and a perpetual focus upon outcomes. So this up on the screen is the top of a sector roadmap developed by the National Smoke-Free Working Group, a group that meets bi-monthly and comprised of key representatives from the key national stakeholders, all of them members of the Smokefree Coalition. I'm talking about ASH, the Cancer Society, Quitline, Heart Foundation, Stroke Foundation, Tala Pacifica, Te Araha Ora, and of course 2 major tobacco control research unit representatives from Aspire 2025 and the Turanga. The District Health Board workforce is represented by elected members, and we invite the Ministry of Health and the Health Promotion Agency as observers to our meetings. We've taken the think tank approach of the Vision Steering Group and made it our model for continually monitoring and developing our sector's activity. The Vision's rationale has become the basis for formatting our strategic objectives. We've structured an action plan around the national and international forums we hold, whereby we can workshop and conduct ongoing consultations with the sector. Key agents like myself are also responsible for holding regional or even smaller consultations on just one focus area of the larger action plan. And in this way, our national body of work is in a perpetual feedback loop with its planners and monitors. And leadership is everywhere. In every role there is to be played inside tobacco control, from enforcement to health promotion, mass media marketing, from cessation service to key legislation's advocacy. Everyone is valued and understands how they contribute to the national goal. And they're all subscribed to the Tobacco Control Update, which is delivered fortnightly by email. I'm the editor and I also tweet. There's my Twitter feed at the bottom of that screen there, at Smokefree by 2020. I'm sticking with 2020, we can do it. These information services are free to the public. I hope to enlist a wider community of informed New Zealanders in this way. Please consider subscribing or following yourself if you're not already. The tobacco control update is also archived by sector issue on a special archive page of the website. You'll see a little flyer with the address there inside your folder of materials. And this is so that you can click on any issue if you need to do research or write a submission or correspond with your leader in support of tobacco control measures. The evidence is all in one place for you to collate very easily. And then every single organisation and their main contact person, possibly more, is listed inside another free service managed by the Smokefree Coalition, the Smokefree Contacts Data Map online. There are two ways to find who you're looking for. You can either click on a region on the map, or you can click on a sector activity. Those are those little coloured cubes to the left. And it's the little coloured cubes are designed so that, all put together, we're a Rubik's Cube, designed beautifully to network. But this service and the tobacco control update have been, both the service and the tobacco control update have been formatted in response to user evaluations. In fact, evaluation is built into the management of the Smokefree Contacts database. This has become a further feedback loop with which the Smokefree Coalition is able to connect at least once each year with every person in the national tobacco control sector workforce. The membership has grown from 21 key members to 56 key members, organisational members. I apologise if you don't see your logo and you're a member of the Smokefree Coalition up on the screen. That's because I couldn't steal your logo from your website and I haven't asked you politely for it. I made a banner with all the members once for a conference, I think it was in 2012. It was out of date within 2 weeks, which was very annoying. I'm not making that mistake again. You can view all of the members at the website, where there is a whole lot more information and resources, including in one very comprehensive document all the resources you need to become a champion for putting tobacco products into dissuasive packaging. This document is on the Publications and Resources page if you want to download it. Basically, the difference between being a member of the Smokefree Coalition and simply freely accessing all of its services online anyway is a matter of the direction of contribution. If you like the idea of getting something for nothing, you can remain a member of the public that visits the site and accesses tons of information that nevertheless inspires your buy-in to the vision and goal of the smoke-free nation by 2025. But if you think your organisation can play a role in terms of championing cessation, prevention, or maybe even legislative change, it starts with just $100. And then following the Smokefree Coalition's example, you start providing your services. Nobody is expected to do everything, but, well, maybe me, I'm expected to do a little bit of everything. But every member is valued in their own particular way and contributes something vital towards the smoke-free goal. That's effective networking and collaboration, where everyone's leadership is necessary, provided with latest evidence and supported by easy-to-access resources. Against the tobacco industry giant, we may be a tiny nation, a tiny sector, but when we're strung together this tightly with a Rubik's Cube in our sling, we're sure to take this big bully down.